Let me ask you something. Do you ever feel like the older you get, the more your calendar fills up with doctor's visits and medical tests? It almost feels like a second career, doesn't it? And while many of these checkups are meant to keep you safe, there's a side to the story most seniors never hear. Sometimes, too many tests can actually do more harm than good. Think of it this way. Imagine your body is like an old, beautiful house. It creaks a little. The paint has faded here and there, but the foundation is strong. Now imagine someone keeps inspecting every corner of that house with a magnifying glass, pointing out every little scratch, every tiny crack, even the ones that have been there for decades and never caused trouble. What happens? You start worrying. Repairs begin, some of them unnecessary, and before long, the house looks worse than before. That's what happens when we overtest after 70. Studies show that up to 37% of tests in seniors lead to treatments, surgeries, or side effects that don't improve health at all. And yet, almost every senior I talk to has no idea this is happening. You probably haven't heard it from your doctor, and you won't see it on a billboard, but today we're going to uncover it together. So grab a cup of tea or coffee, sit back, and let's have an honest conversation. We'll start with a test that sounds so harmless, so routine, that most people don't think twice before saying yes. But the truth is, past a certain age, this scan may cause more fear than benefit. You know the drill. You walk into the clinic, they sit you down, and you're told, let's check your bones. No needles, no pain, just a quick scan that supposedly tells you if your skeleton is at risk of breaking. Sounds simple, right? Almost like stepping on a bathroom scale for your bones. But here's the hidden catch. Once you cross 70, this test often tells you what you already know, that your bones aren't as dense as they were at 40. Well, of course not. That's like telling someone their hair has turned gray or their skin has more wrinkles. It's not a disease, it's nature. And yet, when the scan spits out that number, suddenly you're labeled osteopenic or osteoporotic, and what follows? Fear, medication, and sometimes years of unnecessary side effects. Let's paint a picture. Imagine you're sitting in your doctor's office. They lean in with a serious look and say, your scan shows bone loss. Your stomach drops. You start picturing yourself falling, breaking a hip, ending up in a nursing home. Fear sets in, and that fear is powerful. It pushes many seniors to accept medications without asking enough questions. Now don't get me wrong. For someone in their 50s or early 60s at high risk, bone density scans can be helpful. But after 70, the math changes. Why? Because mild bone loss doesn't necessarily equal fragile bones. Large studies confirm this. One published in the Journal of the American Geriatric Society followed over 1,200 women above 70. The drugs prescribed after a bone scan, bisphosphonates, you may have heard of them, reduced fractures by just 0.3% over 5 years. Did you catch that? Not 30%, 0.3, barely a ripple, and yet those same drugs come with heavy baggage. Bisphosphonates can cause jaw osteonecrosis, a scary condition where part of the jawbone starts to die. They irritate the esophagus, cause chronic acid reflux, and sometimes make bones brittle in strange, dangerous ways. I've had patients who couldn't sleep, couldn't eat comfortably, even gave up hobbies they loved, all because of a pill they were told was protecting them. Take Rose, for example. She was 76, a retired piano teacher, walked every day, had never fallen, never had pain. Her doctor sent her for a DEXA scan during a routine visit. The result? Osteopenia, a mild reduction in bone density that almost every woman her age has. Without hesitation, she was prescribed alendronate, one of those bone drugs. Within 3 months, she had severe jaw pain, couldn't chew properly, and developed constant heartburn. She stopped playing piano, the thing that brought her joy. When she came to us, the first thing we did was stop the medication. Instead, we shifted her to a natural plan: weight-bearing exercises with resistance bands, daily walks, a calcium-rich diet with sardines, leafy greens, and a supplement of vitamin D to cover deficiencies. 1 year later, no fractures, stronger legs, better balance, and most importantly, back to performing recitals. Now here's a question for you. If you haven't fallen, haven't broken a bone, and you feel steady on your feet, do you really need a scan to tell you you're aging? Or would you be better off putting that energy into exercises and nutrition that actually strengthen your body? Because here's the good news. Lifestyle changes work. They don't just change a number on a screen, they change your reality. A 2022 study in Osteoporosis International showed that seniors who focused on resistance training, balance exercises, proper nutrition, and vitamin D reduced fractures by over 20%. Compare that to the 0.3% from medication. That's not just a statistic, that's the difference between keeping your independence and losing it. So what should you do instead of rushing into a DEXA scan and the medication trap? Start simple strength training. Even resistance bands or light weights can make a huge difference. Add foods rich in calcium and protein. Sardines, spinach, almonds, yogurt. Check your vitamin D, because deficiency is common in seniors and directly weakens bones. And don't underestimate balance training. Standing on one foot while brushing your teeth, practicing Tai Chi, or even dancing in your living room can protect you from falls better than any pill ever will. Think of your bones like a tree trunk. Over the years, it naturally develops cracks. The bark roughens, but the roots, if strong, keep it upright in any storm. Strength training and balance exercises are your roots. Pills? At best, they paint the bark. The problem is, the medical system often pushes tests because that's the default. A doctor might think, better safe than sorry, but sometimes, better safe turns into unnecessary treatments. That's why it's so important, especially past 70, to pause and ask, what will this test change for me? If the answer is probably nothing, it may be wiser to skip it. Now don't get me wrong, if you've had fractures, if your doctor sees a real reason for concern, then a scan may have its place. But for the average healthy 70-year-old, the risk of being pushed into medications outweighs the tiny benefits. So next time someone offers you a bone density scan, remember Rose's story. Remember the studies. And most of all, remember that your bones are not doomed just because a machine says they're thinner. They're alive, dynamic, and responsive to movement and nutrition at any age. And that's just the beginning. Because if you think bone scans can create unnecessary fear, wait until you hear about the next test. It's one that sounds reassuring, even high-tech, but in reality, it often leaves seniors anxious, undergoing procedures they never needed, and sometimes facing risks far worse than the problem it was supposed to detect. Let's be honest. Forgetfulness is one of those things that sneaks up on us. You walk into the kitchen and suddenly wonder, wait, what did I come in here for? Or you're telling a story, the name of a neighbor, an actor, or even a grandchild's friend is right on the tip of your tongue, but it just won't come. Sound familiar? Of course it does. It happens to everyone. And yet once we pass 70, these little slips feel scarier. The thought comes creeping in. Is this normal, or is it dementia? That fear is powerful. It can keep you awake at night, second-guessing yourself, wondering if the person you used to be is slowly slipping away. And here's the problem. Our medical system often takes that fear and pours gasoline on it. How? By sending seniors straight to a brain MRI. Now don't get me wrong, MRIs are incredible machines. They're like a super high-definition camera for the brain. They can see structures, blood flow, tiny spots that no X-ray ever could. But here's the uncomfortable truth. In older adults, most of what an MRI shows is simply aging, shrinkage here, a few white spots there. Changes that are as natural as wrinkles on your face or gray hairs on your head. And yet, once those spots are found, the damage begins, not to your brain, but to your peace of mind. Because when you hear, your scan shows abnormalities, what's the first thing you think? Alzheimer's, dementia, decline, even if those so-called abnormalities are perfectly normal for your age. A 2021 study published in Neurology Today looked at over 3,000 brain MRIs in people aged 70 to 85 who had mild memory complaints. And here's the shocking part, 86% showed some kind of abnormality. But guess how many were linked to an actual treatable condition? Only 3%. That means 97% of those scans led to unnecessary worry, extra tests, and often procedures that didn't help at all. Let me tell you about George. He was a 74-year-old retired engineer, sharp as a tack most of his life, but he started noticing he misplaced his keys more often, forgot names at church. His family got worried. His doctor ordered an MRI. The scan showed white matter changes, completely typical for his age. But the report didn't say normal. It said abnormal findings. George panicked. He convinced himself he had dementia. He stopped driving, stopped going out with friends. Within months, his anxiety was worse than his memory ever was. When he finally came to us, we did a simple cognitive test. Nothing fancy, just questions on paper to check recall, attention, and problem solving. Guess what? He scored well within the normal range. The problem wasn't his brain, it was the fear that the MRI planted. Once we explained this to him, encouraged better sleep, hydration, and brain exercises like puzzles and reading, his confidence returned. Within 3 months, George was back to his old self. Now let me ask you this. If you sometimes forget names or misplace your glasses, does that mean your brain is failing? Or could it just be the natural clutter of a life well lived? Think of your brain like a library. The shelves are packed with decades of books. Sometimes it takes longer to find the one you need, but that doesn't mean the book is gone. It just takes a little more time to reach it. And here's where things get even trickier. Once an MRI shows something vague, doctors often feel pressured to do something. More tests like spinal taps, where fluid is drawn from the spine, or even biopsies. In that same study, nearly 12% of older adults ended up undergoing invasive procedures after their MRI, all based on changes that were age-appropriate. Think about that. A perfectly healthy senior ends up in the hospital for a spinal tap because of a few white spots that meant nothing. I know what you're thinking, but what if it is dementia? Shouldn't I know early? Great question. And here's the key. MRIs don't actually diagnose dementia. They can show brain shrinkage or changes, but they can't tell you if you're going to lose memory or how fast. What really matters is function, how you live, how you think, how you solve problems day to day. That's why cognitive screening tests are the first and best step. They're cheap, paper-based, and take just a few minutes. More importantly, they measure what matters, your ability to live independently. And here's another layer of reassurance. Research shows that lifestyle makes a huge difference in brain health, even in your 70s and beyond. Sleep, getting deep, restorative rest, cleans the brain like a dishwasher, flushing out waste proteins linked to memory decline. Hydration keeps your brain cells firing smoothly. Exercise brings fresh blood and oxygen, building new connections. And mentally stimulating activities, crossword puzzles, learning a new song, even telling stories to your grandchildren, keep those neural pathways alive and kicking. So here's my advice, as a friend and as a doctor. If you or someone you love starts to notice mild memory slips, don't panic and rush for a brain MRI. Instead, ask for a cognitive screening test. If the score is normal, focus on lifestyle first. Save the MRI for when there are serious neurological symptoms like seizures, sudden changes in personality, or a rapid loss of ability to function. That's when imaging makes sense, but not for the everyday where are my keys moments, because at the end of the day, your brain isn't a machine that wears out on a schedule. It's more like a garden. Yes, some leaves wilt, some branches bend, but with sunlight, water, and care, it can keep blooming beautifully, even in late life. Now let's pause for a second. You've seen how bone scans can trap seniors into unnecessary medication, and how brain MRIs can create fear where none is needed. But what about the heart, the one organ everyone worries about? The next test on our list is handed out like candy to older adults, and while it looks like a smart precaution, it can lead to stents, surgeries, and complications that don't actually extend life. Stick with me, because what you'll hear next might just surprise you even more. Now let's talk about the heart, the one organ everyone worries about most. After all, if there's one thing seniors don't want to hear, it's heart trouble. That's why the cardiac stress test has become one of the most common exams ordered once people pass 70. You walk into your doctor's office, mention a little fatigue or shortness of breath, and suddenly you're scheduled to walk on a treadmill with wires all over your chest. Or worse, you're given medicine that makes your heart race as if you were running. It sounds logical, right? Test the heart under stress, see if the arteries are blocked, catch a problem before it becomes a heart attack. But here's the twist. In older adults, this test is often more misleading than helpful. Why? Because the rate of false positives when the test says something is wrong but it isn't can be sky high. In people over 70, some studies show false positive rates of 40%. That means almost half the time the test is crying wolf. Now imagine this scenario. You're 72. You do your daily walks. You feel fine most of the time. One day you tell your doctor you felt unusually tired climbing a hill. Out of caution, they order a stress test. The machine spits out possible blockage. Suddenly you're sent for more tests, angiograms, catheterizations, and before you know it, you're lying on a table with a stent in your chest. Sounds extreme. It happens every day. Here's the shocking part. Research published in JAMA Cardiology found that more than half of the stents placed after stress test referrals were done in patients who had no symptoms that required them. And you know what the survival benefit was? 0. Those patients didn't live longer. They didn't feel better. But they did face higher risks: bleeding, kidney injury from the contrast dye, hospital stays that lasted days or weeks. Let me tell you about Raymond. He was 75, a retired postman who loved his daily walks. His only symptom was getting a little tired on steep hills. which, let's be honest, who doesn't? His doctor, just to be safe, sent him for a stress test. The results looked suspicious, so he was referred for a catheterization, where doctors thread a tube into the arteries. They saw a mild narrowing and decided to place a stent. That night, Raymond had a bad reaction to the dye. His kidneys were damaged. He spent 6 days in the hospital, and when he finally got home, he was just as tired on hills as before, because the real problem wasn't his heart. It was simple dehydration and age-related fatigue. This is the real danger of over-testing, not just the physical risks, but the emotional toll. Imagine being told you might have a serious heart problem, only to find out months later that you didn't need the procedure at all. That fear, that stress, lingers. Now let me ask you, what do you think is better? To be rushed into invasive tests that may not change anything, or to start with safer, simpler evaluations? Because alternatives exist. A resting EKG, for instance, takes just a few minutes. You sit quietly, electrodes measure the rhythm of your heart, and your doctor gets valuable information without putting your body under stress. Another option is a coronary calcium scan, a quick, low-radiation imaging test that shows whether dangerous plaque is building up. Both of these are far less risky and often more useful in seniors. And don't underestimate lifestyle. Often what feels like heart trouble in seniors is actually something else: dehydration, low fitness, anemia, or even sleep issues. Small changes, drinking more water, improving diet, gentle exercise, can make fatigue vanish without ever needing a stress test. Here's a metaphor I like. Think of your heart as a car engine. If you drive it normally and it runs smoothly, do you really need to push it to the red line just to prove it's okay? That's what a stress test does. It revs your engine at maximum, hoping to catch a problem. But if your car is already running fine, all you're doing is risking damage. Of course, there are exceptions. If you experience true warning signs, like chest pain during activity, severe shortness of breath, dizziness, or fainting, then yes, more thorough heart tests may be necessary. But for the average symptom-free senior, a stress test is often a door to procedures you don't need. So the next time someone suggests a cardiac stress test, just to be sure, pause and ask, what happens if it shows something? Will it really change my treatment, or just lead to more invasive procedures? If the answer is vague, you may be better off with simpler, safer checks and a focus on lifestyle. Because here's the real truth: the best way to keep your heart strong after 70 isn't on a treadmill in a hospital. It's in your daily habits. Walking, staying hydrated, eating a balanced diet, managing stress, sleeping well. Those are the things that extend life and keep the heart beating steady. And speaking of tests that can spiral into risky territory, the next one may surprise you. It's a procedure most people consider the gold standard of cancer prevention. But after 70, the balance shifts. The risks can outweigh the benefits, and the complications can be devastating. I'm talking about colonoscopies, and the truth might shock you. Now let's move on to one of the most famous checkups out there, the colonoscopy. For decades, it's been called the gold standard for catching colon cancer early. And in middle age, it really can save lives. But after 70, and especially beyond 75, the story changes, and not in the way most people expect. Here's the truth. A colonoscopy is not a gentle test. The preparation alone can be rough. Gallons of laxatives, long hours in the bathroom, dehydration, dizziness, and sometimes kidney strain. Then comes sedation, which may affect brain function in older adults, sometimes leading to confusion or even lasting memory issues. And the procedure itself? It's invasive, with real risks: bleeding, tearing of the bowel, even heart rhythm disturbances during sedation. Now here's the shocking math. A massive study in JAMA Internal Medicine looked at more than 1.3 million seniors on Medicare. For every 1,000 colonoscopies performed in people over 75, only 2 lives were saved. 2. But more than 20 experienced serious complications. That's a risk-to-benefit ratio of 10 to 1 against the patient. Take Dana, a 73-year-old grandmother. No symptoms, no family history, and she had already had 2 clean colonoscopies earlier in life. Her new doctor still pushed her to repeat it. During the procedure, a tiny polyp was removed. That night, Dana collapsed from abdominal pain. It turned out she had a bowel perforation, a dangerous complication. 9 days in the hospital, 10 pounds lost, and she never regained the same energy, all for a polyp that might never have caused harm. So let me ask you, if a test causes more harm than good, is it really preventive care? Or is it a risk dressed up as reassurance? Now, I'm not saying colonoscopies are bad across the board. If you're younger, or if you have specific symptoms like blood in the stool, major changes in bowel habits, or a strong family history, then yes, this test can be life-saving. But once you cross 70, the balance shifts. The risks of sedation, dehydration, and complications start to outweigh the benefits. And after 75, Most experts, including the U.S. Preventive Services Task Force, recommend stopping routine colonoscopies altogether. So what are the safer options? Thankfully, there are plenty. A simple stool test like the FIT test can be done at home. No prep, no sedation, no hospital gowns. You mail in the sample, and it can still catch most concerning cases. For many seniors, that's more than enough. Think of it like this. If colonoscopy is a bulldozer, loud, powerful, and risky, stool tests are like a metal detector. Quiet, safe, still able to find what matters without tearing up the whole field. At the end of the day, prevention should protect, not endanger. After 70, protecting your colon may be less about big invasive procedures and more about simple habits, eating fiber-rich foods, drinking enough water, moving your body daily, and using gentler screening tools when needed. And that brings us to our final and perhaps most shocking test, a test that's marketed as cutting-edge prevention, but actually exposes seniors to huge risks. It's not just unnecessary, it may even cause cancer itself. I'm talking about full-body CT scans, and what you'll hear next might truly change the way you see modern medicine. Now let's talk about the test that sounds the most futuristic and protective of them all. The full-body CT scan. You've probably seen it advertised in glossy brochures or private clinics. A complete scan from head to toe to catch cancer early. It sounds almost irresistible, doesn't it? Like buying peace of mind in one quick appointment. But here's the problem. That promise is more illusion than reality. Because while CT scans can indeed show incredible detail, they also expose you to a huge dose of radiation. To put it in perspective, one full-body CT scan delivers as much radiation as about 500 chest X-rays. And in older adults, that's not just a number, it's a real risk. A 2023 study in JAMA Internal Medicine estimated that CT scans may now account for up to 5% of all cancers in the US. Imagine that, 1 in 20 cancers caused not by smoking, not by diet, but by a medical test that was supposed to prevent disease. And the irony runs deeper. These scans often pick up tiny nodules, calcifications, or cysts that are harmless, normal signs of aging. But once they're spotted, the machine doesn't say, "Don't worry, this is nothing." It says, "Abnormal finding." And from there begins a chain reaction. More scans, biopsies, sometimes even surgeries, all for something that never would have harmed you in the first place. Take Marcus, an energetic 80-year-old who taught martial arts to other seniors. He felt great, fit, active, sharp. He signed up for an executive health package that included a full-body CT scan. The scan showed a tiny nodule in his lung, just 3 millimeters wide. It was likely harmless, but the doctors couldn't ignore it. He was sent for a PET scan, then a needle biopsy. The result? Benign. But the biopsy punctured his lung, leading to a collapse. He spent weeks in the hospital and months recovering. A man who was thriving ended up weakened, not by illness, but by the test itself. So let's ask the key question. If a test doesn't extend life, doesn't improve quality of life, and may even trigger cancer, why do it? The American College of Radiology is very clear on this. Full-body CT scans should never be used for general screening in people without symptoms. The risks simply outweigh the rewards. That doesn't mean CT scans have no place. If you have specific symptoms, like unexplained weight loss, coughing up blood, or swelling, then a targeted scan of that area can be life-saving. But scanning the whole body just in case is like walking into a minefield to look for treasure. You might find something, but the damage along the way could be far worse. So what should you do instead? The answer is refreshingly simple. Listen to your body. If you feel well, if you're active, eating well, and sleeping soundly, then your best scan is how you feel day to day. Regular check-ins with your doctor, blood tests when needed, and focused imaging only if clear symptoms appear. That's the smart, safe path. Think of it like gardening. You don't dig up every inch of soil just to check if the roots are okay. You water, you nourish, you observe, and if a plant shows signs of trouble, then and only then do you dig deeper. Your body deserves the same respect. So the next time you see an ad for a full-body scan that promises to catch everything early, remember Marcus, remember the radiation, and remember that sometimes the best prevention is not more tests, but more trust in your body, your lifestyle, and in smarter, safer medicine. Now we've covered bone scans, brain MRIs, stress tests, colonoscopies, and CT scans, 5 common checkups that after 70 can do more harm than good. But what's the real takeaway from all this? That's what we'll dive into in the conclusion, and I promise it's not about fear, but about freedom. So we've walked through 5 checkups that most people assume are helpful, even life-saving. bone density scans, brain MRIs, cardiac stress tests, colonoscopies, and full-body CT scans. On paper, they sound like protection. In reality, past 70, they can create fear, trigger unnecessary treatments, and sometimes even harm the very people they're meant to protect. Now let's pause here. What's the bigger lesson? It's this. Modern medicine is powerful, but it isn't perfect. And once we pass 70, the rules of the game change. A test that's useful at 50 might be risky at 75. A procedure that saves one person might create complications for 10 others. That doesn't mean we throw away medicine. It means we use it wisely, with a sharper eye and better questions. Here's a simple question I encourage every senior to ask before agreeing to a test. If this exam finds something, what happens next? If the answer is vague, if it sounds like probably more tests, or just in case, that's your red flag. Because the goal of prevention isn't to collect numbers on a chart, it's to live longer, stronger, and happier. Think of it this way. Imagine your health as a garden. Some weeds will pop up, some branches will bend, but you don't need to dig up the entire soil every week. You water, you nourish, you give it sunlight. That's what lifestyle does for your body. Daily movement, balanced food, good sleep, strong social connections. These are the true fertilizers of health. They prevent far more disease than a CT scan ever could. And the science agrees. Studies show that resistance exercises, good nutrition, and proper sleep reduce fractures, protect memory, and strengthen the heart far more effectively than over-testing. In other words, the habits you can control matter more than the machines you're put into. So where does that leave us? With freedom. Freedom from unnecessary fear. Freedom from being treated like a collection of numbers instead of a person. Freedom to say no when a test offers little benefit but high risk. And the freedom to say yes to the things that truly matter. Staying active, staying engaged, enjoying the people and passions that make life worth living. Now I'd like to hear from you. Have you ever gone through a test that turned out to be unnecessary? Did it leave you worried or even cause complications? Share your story in the comments below, because your experience could help someone else make a smarter choice. And if this video gave you a new perspective, consider subscribing for more conversations like this. We share not just facts, but the kind of wisdom that can keep you living with strength and confidence well into your 70s, 80s, and beyond. At the end of the day, prevention isn't about endless scans and procedures. It's about choosing wisely, living fully, and remembering that less can sometimes mean more.